Good morning, students. In the MGT pathology course, given 4 MCQs. First one is, which of the following is not a variant of prostate specific antigen? A. PSA density, B. PSA velocity, C. PSA nodularity, and D. ratio of free and bound PSA in the serum. And the answer is PSA nodularity. There are 6 variants in PSA value. One is age specific reference range, second is PSA density, and the third one is PSA velocity, and the fourth one is ratio of free and bound PSA in the serum, and 5 is free versus total PSA, and 6th is pro PSA. So the answer is PSA nodularity. C is the answer. Teratozoospermia refers to absence of semen, absence of sperm, all dead sperms in ejaculate, morphologically defective sperms. The answer is morphologically defective sperms. Hemospermia is presence of erythrocytes in the ejaculate. Aspermia is no semen or no retrograde ejaculation. Leucospermia is presence of leukocytes in the ejaculate above the threshold value. Asthenozoospermia is percentage of progressively motile spermatozoa below the reference point. Azoospermia is no spermatozoa in the ejaculate. Cryptozoospermia is spermatozoa absent from fresh preparation but observed in a centrifuged pellet. Necrozoospermia is low percentage of live and high percentage of immotile spermatozoa in the ejaculate. Asthenoteratozoospermia is percentage of both progressively motile and morphologically normal spermatozoa below the lower reference limits. Oligoteratozoospermia is total number of spermatozoa and percentage of morphologically normal spermatozoa below the lower reference limits. Oligozoospermia is total number of spermatozoa below the lower reference limits, and teratozoospermia is percentage of morphologically normal spermatozoa below the lower reference limit. That's why here the answer is option D. Teratozoospermia refers to morphologically defective sperms. Coming to the 8th question. HCG is raised in all except A. choriocarcinoma, B. seminoma, C. yolk sac tumor, and D. teratocarcinoma. The answer is yolk sac tumor. Beta HCG mnemonic SEC. S is seminoma, E is embryonal carcinoma, and C is choriocarcinoma. The teratocarcinoma is made of embryonal carcinoma with teratoma. Shows the increased HCG. Out of the options, only yolk sac tumor is the one in which HCG is not raised. Final MCQ from MGT pathology is, testicular involvement without epididymitis is a feature of gonorrhea, syphilis, tuberculosis, and granuloma inguinale. The answer is syphilis, because it is more common in the epididymis than in the testis, syphilis. And gonorrhea, tuberculosis almost invariably arise in epididymis, whereas syphilis affects the testis first. Here the answer is testicular involvement without epididymitis is a feature of syphilis.